Warning sign COVID-19 is in your lungs. As a doctor, I know the coronavirus COVID-19 has revealed itself to be a master of disguise. Whereas some people can have it and have no idea they are infected. Others end up in the intensive care unit, unable to breathe and on a ventilator since the virus targets the lungs. So, what should we look out for? What are the signs our lung function is deteriorating? Here are some points of relevance. However, if you are concerned about your clinical condition, I would urge you to seek a professional help sooner rather than later, because all respiratory functions can get worse with frightening speed. You need to get help promptly before things progress too far. Here are some tips what you can do before going your situation worse. Number 1. First, take stock of the severity of your infection. If you are unlucky enough to become infected with COVID-19, the episode may last up to 2 weeks in mild cases or 3 to 6 weeks in severe or critical cases. The severity of COVID-19 infection has been divided into 5 groups. Number 1. Asymptomatic. Number 2. Mild disease. Number 3. Moderate disease. Number 4. Severe disease. Number 5. Critical. Acute respiratory distress syndrome or ARDS. Experience from Wuhan, where the virus originated, showed 81% of COVID-19 patients had mild disease. 14% of those infected developed severe pneumonia and around 5% required critical care. When we consider if the lungs are failing, we are especially interested in people passing from mild and moderate disease to severe or critical. Mild to moderate disease can be managed at home. People with severe or critical disease need hospitalization. The following are 5 symptoms or clinical signs to look out for, which will help decide if your infection is passing from moderate to critical severity and, if so, needs urgent help. Number 2. Your cough is getting worse. Up to 82% of patients infected with COVID-19 have a cough. This is typically dry and irritating. Experts describe the cough in the early stages of the disease as coughing episodes which can last up to an hour and with 3 or more coughing bursts in 24 hours. Coughing is due to inflammation of in your airways. A cough is a reflex designed to protect your body from invasion with foreign particles such as bacteria and viruses. If your lungs are inflamed, a cough also expels mucus and cellular debris. In a way, a cough is a good thing. However, too much coughing is exhausting. It further interrupts the supply of oxygen to your lungs and can, although rare, cause serious problems such as fractured ribs or even small destruction in your brain. If your cough is worsening, this can be a warning sign the infection is progressing to cause a more severe full-blown pneumonia. Number 3. You are finding it hard to breathe. Breathlessness was reported by 31% of patients from the initial experiences in Wuhan. It is very frightening not being able to breathe. The degree of breathlessness is probably the most important clinical indicator of the severity of your condition. If you have clinical signs like strain from breathing or inability to breathe interferes with normal daily activities, you need to be getting urgent medical help, as these are the signs of COVID-19 has passed from a moderate to severe condition. Number 4. You are super fatigued. Fatigue was one of the most common symptoms reported from the first experience of COVID-19 in China and was reported in around 70% of patients around the world. As the fatigue worsens, you may become listless, unable to watch TV or concentrate or communicate effectively. Other medical complications can also occur, including possible secondary bacterial infection. In the most critical cases, there may many overwhelming infection with sepsis and septic shock. If your tiredness is progressing and becoming extreme, this is a sign of coronavirus infection is becoming severe. and your pneumonia is worsening. You need to seek urgent help. Number 5. Your leaves are blue. If your leaves, fingers and toes are looking blue, this is called cyanosis. This is a serious sign of poor lung function and you must get urgent medical help. When you breathe in, your lungs deliver oxygen to the heart and the rest of the body. The lungs also excrete carbon dioxide in the air you breathe out. When you have severe pneumonia, such as with COVID-19 infection, your body can lacking in oxygen and are also unable to get rid of carbon dioxide. Well oxygenated blood is a cherry red color, giving your skin a nice reddish or pink tinge. However, deoxygenated blood has a darker red color, and when light reflects off the skin, it now appears a dark navy blue. This bluish tinge is seen on the leaves and on the tips of the fingers and toes and in the nail beds. Number 6. You are having chest pain. This is not being widely reported as a major symptom of COVID-19. However, pneumonia of any cause can cause chest pain. Coughing and straining in intercostal muscles can cause pain. Severe coughing can cause a fractured rib or a pneumothorax, a lung collapse. Patients do report chest tightening with COVID-19, which may be due to bronchospasm, especially in people who are known asthmatics or have a tendency to wheeze when they get a respiratory infection. Number 7. Final thoughts from the doctor. If you think you have COVID-19 infection, the advice is to stay at home. However, this is a serious viral infection which causes pneumonia. If you feel your condition is deteriorating, you must keep help. It can be hard to judge how well or badly your lungs are coping with a COVID-19 infection. Never worry about wasting anyone's time. Lung function can deteriorate rapidly, and it is always best to act earlier rather than later. If you can identify with any of the 5 symptoms listed here, it's time to be calling your doctor. Thank you.